Oral hygiene is important because it tends to be a good overall indicator of how somebody takes care of themselves and how they view their own health. If somebody is vigilant with keeping their teeth and their gums clean, most of the time you can count on those patients to monitor their blood pressure, monitor their weight, monitor all those things that are indicators of how their health is doing or things that could lead to other problems in their health. We typically say that parents should watch their children's mouths while they're young, in their young years, because we typically can't get into those younger patients' mouths. Now, pediatric dentists, they can, or they can be sedated and do, but routinely, most of the time, children are pretty good until they are around the 2 or 3 years old mark. The pediatric societies and organizations typically encourage the public to have the children see their dentist at age 1 or 18 months. It varies between different groups, but personally, I like to see them when they're aware of what's going on so that they cooperate a little bit better.
One of the most common things that patients complain about is bad breath. And so anytime that we have poor oral hygiene and we're not brushing and flossing and keeping our mouth clean, the thing we notice the most is that our breath doesn't smell so great. So the best way to combat that would be to make sure that we're brushing and flossing every day. You know, oral pain, teeth that are hurting us, that kind of thing will come as well, but that's usually later on. Usually our first clue that we're not brushing and flossing and taking care of our teeth the way that we should be is that we have malodor. There's not really a right or a wrong way to brush your teeth. You know, if you're not hurting your gums, your gums are going to be your best gauge on whether or not you're brushing incorrectly or not. If your gums are not sensitive, then you're brushing properly. We can get technical and make sure we have them at have our toothbrush at a certain angle, but we want to make sure we're brushing our gums as well as our teeth. Ideally, 2 minutes would be fantastic. When we're brushing with a manual toothbrush, 30 seconds feels like forever. So if we're having trouble spending enough time in there, I usually have a patient use an electric toothbrush with a timer. And then once they've gotten used to brushing for that long, how it feels afterwards is a better gauge of if our teeth are clean or not. There is a technique to flossing, we call it C-shape flossing, where you take the floss down between the contacts of the teeth, where the teeth touch each other, and then you want to wrap around the tooth and then glide underneath the gum tissue. If you go straight down, it can cut the gums and it'll make them bleed, and it's tender. So it takes us a little while when we first start flossing to make sure that we're doing it properly, but once we do it properly, it should not hurt. Our overall health of our whole body starts in our mouth. So it's important that when we wake up in the morning, that we brush and we make sure that our mouth is clean. We use our mouth is part of our body. We use our smile to greet people right off the bat every day, and we want to make sure that that's clean and presentable for everyone that we come in contact with. We want our systemic body to be healthy. We want to be able to not have the bacteria in our body, and if we can keep that bacteria level low in our mouth through brushing and flossing, then we're overall going to be healthier, happier people.